Hello, everyone, and welcome to this webinar titled Unlocking AMR Innovation Through Surveillance Data. This is co-hosted by the Global Health Network and Vivli, and we're happy to have you here with us. And so with that, I would like to welcome you all to the Global Health Network and Vivli co-hosted webinar, Unlocking AMR Innovation Through Surveillance Data. As a quick introduction to the agenda for today, we'll start with introductions of our two speakers. We'll then go into depth of the Global Health Network, providing an overview as well as looking more into the inequality in global health research and how the TGHN helps address that, as well as the AMR and the AMR Knowledge Hub. After that, we'll hear from Vivli for an introduction to the AMR register, industry surveillance data, as well as use cases on how it's been used to date. And then lastly, ending with the Vivli AMR Surveillance Data Challenge. And after we hear from the TGHN and Vivli, we'll then link together both of those concepts to try and address and determine future research questions that can utilize AMR surveillance data. And then after that discussion, we'll have a closing and thank you. Today's speakers are Geetanjali Kapoor from the Global Health Network. She's a physician and researcher, and then myself, Amanda Skarlupka, a senior program manager for Vivli. And with that, I'll pass it off to you, Geetanjali, to introduce yourself and to also introduce the TGHN.
Thank you, Amanda, and thanks for inviting TGHN for this webinar. I'm Geetanjali Kapoor. I'm a physician, and I've done my specialization in microbiology and public health from the Johns Hopkins University. Currently, I am a visiting academic with the Oxford University and with the TGHN, about which I would get into in a bit. And previously, I have worked with different organizations. And one of the important assignments I was doing was the Fleming Fund in Africa. So I was the AMR technical lead on that. And I'm sure most of you would be knowing about that. So with this, and not without much ado, I'm going to just share my screen. I also would just like to let you know that we do have from the TGHN, Adam Dale with us also on this call. Yeah. So the Global Health Network, TGHN for short. And as you can see on the screen, it just speaks for itself. We aim to create equity in access to knowledge and opportunities. And I would, of course, be getting into details. A quick introduction about the organization, about its global presence, the inequity we're trying to address, and then we'll get into AMR, specifically the Knowledge Hub, and about the surveillance. Now, what is the Global Health Network? It's basically a global community of researchers and research organizations. And the idea is basically to connect them so that there can be collaborations and knowledge can be shared, given and taken both. And with the aim basically to reduce the inequities which exist today in research. And we know about that. Most of the research is happening and being led by, in say 90% is being led by a certain section or a faction, and not really representative of everybody on the globe. So we would like to reduce this inequity. We also, TGHN also has lots of resources about which I would be getting into details. But in just short, we have trainings, various programs, tools, seminars, and various even in-person meetings. Now, I would also like to emphasize that we have been recognized as a WHO Collaborative Center and also recently been invited to establish a formal program under the United Nations Office for Project Services. Now, the TGHN, it is currently active in more than 60 countries, spanning Africa, Asia, Europe, and the Americas. And we are connecting more than 60 research organizations and networks, and over 1.2 million health workers and researchers. So 90% of the world's research is basically only benefiting less than 10% of the global population. We know about this, and as you can see on this pyramid, most of the research is being led from outside. So the data which is going to this research is extracted from the low middle income countries, but not really led by the researchers working over there. So the aim of TGHN is going to be to reduce these kinds of inequities by building the research capacity even in the low middle income countries. Now, to this effect, even the World Health Assembly in the Directive 75.8, it had called for the countries to strengthen their research systems, and WHO was tasked with implementing this resolution. Now, on this screen, what you can see is that you can see two parts of the screen. So out here, what we're trying to show is the various organizations which have actually contributed in establishing different kinds of knowledge hubs, and who's actually benefiting out of it is the researchers. Like many of us, we would like to get trained on different components. So we have these access to these resources. So I'm sorry for my cough. I just had got this flu over the weekend. Now, as I'm just mentioning over here, we have these knowledge hubs. Not getting into much detail, but different kinds on different aspects, different themes. Of course, we will deep dive into the one which is circled here, which is the AMR Knowledge Hub. And you can also see on the right side various in-person meetings, discussions that are done. Now, why do we actually do it? The idea is basically to strengthen research capacity. And as you can see, that research is not just like collecting data, it goes beyond that. You collect data, you analyze it. You, of course, involve the policymakers, you talk to your stakeholders. And so it's a continuum of various processes. So the TGHN, it aims to kind of strengthen capacity across all these different themes, all these different sub processes. How do we measure the impact? The TGHN has endeavored to measure the impact for every program, both in terms of the quantitative aspects, and as you can see over here on the screen, we have more than 1.2 million members who are actively contributing, and we have up to date about 7 million upwards unique visits to the platform. And of course, lots of webinar registrations have happened. So these are our stats. And in terms of the difference it is making, these are all, real information we have got from primary research from our stakeholders. And like, for example, I'll just maybe focus on what happened in Rwanda, one of the Rwanda hospitals. They didn't have the capacity and the knowledge on how to conduct research. And they have appreciated the information which the TGHN has shared online. It's all open forum, and based on that they were able to then get into creating TB diagnostic trials, and successfully working on that, and also now heading towards working on malaria research. And like this, we have various examples from various countries across the low middle income nations, and they have appreciated the capacity building and knowledge that has been shared across through the various knowledge like research clubs, skills have been shared, and twinning activities, so through various forums. Now, this was a nutshell about what the Global Health Network basically is doing. It's across themes. Now, coming to AMR, basically what we all know, and it's also been called out as one of the top 10 priorities by the WHO. We all know that AMR is a very natural phenomena. It happens in microbes. You just cannot stop it. But yes, it is exacerbated due to certain predisposing factors such as overuse and misuse of antimicrobials. Uh, it has no bars. It crosses regions. It crosses like from human to animal to environment. It's just all over. So we call it as a One Health problem. And we all know that it's also reversing medical advancements today. Now, the knowledge, the TGHN, we also have our AMR knowledge hub out here. And we would also be, so this is the page you will see when you go on the TGHN and you click on the AMR knowledge hub. This is what you actually see, and you can all even link your names on this. And so we can, you yourself can associate with various researchers with whom you think you would like to do some program, or you want to learn something. So we do have this collaborative map on the website. So as I said earlier, this is a community for researchers to collaborate, conduct, and share knowledge. Lots of resources are there. We have information on certain study profiles from various countries. Then we can also you can also look into information specific to, say, stewardship, or you want to know something about what's happening in the conflict regions or drug resistant TB. You have a volume of information out there on the TGHN's AMR Knowledge Hub. Now, over here, we have about more than 17,000 registered members. And most of these members are there from the low middle income countries, which of course is but justified, considering that AMR is very, very prevalent in these areas. And as I mentioned earlier, we also have the AMR collaboration map. So you can, as a researcher, if you're working in AMR and you want to look into which other researchers are in my area, or in an area of your interest, you can always find that out through this AMR collaboration map. Now, I would like to now talk about a little bit about the surveillance. Surveillance is all about how do you basically find out what is the burden. And for that, of course, you need to collect the data. Now, here on my screen, you can see that data could either be just, very silo, like it's just in the hospitals and been, pulled out from there, or the labs or clinical trials, etc. That is unaggregated, it's not standardized. So that particular hospital or wherever the data is, just they will analyze and that's it. But if you really want to make sense out of this data, you need to collaborate, or you need to share this data with partners. So that's where we bring in the concept of collaborative data ecosystems. So this is basically data which is on a unified platform, and we will of course be hearing more about what are some of these examples. So over here, what happens is the data is basically aggregated. And when it's aggregated, it's just not like you put everything together. You have to standardize it in a particular way, because the data is now originated from different types of labs with different qualities. And so everything has to be put on the same pedestal. So a lot of standardization has to be done. We basically call it as metadata standardization. And then a certain access, control access also has to be provided. So why do we think this sharing of AMR data is important? What's wrong if we just let it stay where it was? It really would not help anybody, right? So if you can see on this slide, I've talked about four different solid reasons. Of course, there are many more why we need to share the data. One is identify. Identify what? We would like to know which are the pathogens of concern today, which are the regions where it's actually getting originated. So we call it the hotspot. And what is the trend over the few years? That's one thing important. And how does this help us? It would help us to then accordingly, tweak our standard guidelines or our health programs, and also inform the treatments. It also helps us in deciding on how can we do better research and develop newer diagnostic drugs, vaccines through various kinds of modeling studies. And of course, it helps to, if you share data, you are also contributing to reducing the inequities and building a global solidarity, because you are going to be sharing your knowledge across. So Various health programs basically today on AMR surveillance are not just restricted to one hospital. It goes across, across a country or across a region, because the whole idea is to strengthen one health. And in fact, it also goes across. You jump domains and you talk about environment or you talk about animal sectors also. So it's all about pooling information. However, it's not all that easy. For me, it might be very easy as a speaker to say, oh, well, we must share our data. But honestly, in the real world, sharing of AMR data is very challenging. Again, on this slide, you can see what I've tried to do is create four different main groups on what are the reasons or what are the challenges in AMR data sharing. Of course, there can be more, but let's talk about these four important ones. The first one is data governance. Now, what is the challenges? Why do we say data governance could be a challenge? Because first of all, everybody who has the data, and if they have to share it, they need to be very sure that it's being used in a very credible way. Then, of course, there would be some information about patients which is identifiable that needs to be protected. Then the researchers, they would like to be recognized if any information is getting published, so they need to get recognized. So this all is actually of course very justified. The concerns are justified. We definitely need ethical use agreements in place, and all this takes time. So data governance is a concern. Another challenge in sharing AMR data comes from the fact that yeah, I mean, like all of you who have seen the labs, every lab is different. We can have a lab which really performs extremely well, and there are labs which may be just in a primary health center. They may not be having that kind of knowledge. So these kinds of systems are not homogeneous. So hence, when the data is tested, the data is coming from these labs. It's a different. It's not comparable. Also, it may not be possible to collect the AMR data from all the labs in a particular country, right? So we would go, if you're doing a program, you will decide, okay, we're going to pick up these labs. As a result, there will be a bias in your collection method, in your sampling. You might miss out on certain other important areas. So all this leads to data which is, like, we can say apples and pears together. But of course, what is important is then we need to standardize this. So then these are some challenges that are there. Having said that, it doesn't mean that it cannot be shared. They need to be mitigated. We need to find ways in which we can standardize the data better. Another challenge in sharing AMR data is about, you know, like the countries, they might say, oh, well, if our data is released and it's shared internationally, and just in case the AMR data shows a lot of resistance, it can affect the tourism or it can affect the reputation of that particular institutions, and maybe some more regulations are then brought in place. So these kinds of perceptions and implications is also a deterrent. And then we talk about the surveillance system. Surveillance systems, at first place, we all know they're not very robust in most of the places. As a result, if you don't have the systems, you don't have the AMR data, how will you even produce information for further sharing? Right? So, in short, these are some of the challenges. Now, uh, having said that, of course, we also know that there are currently platforms where the data is available on AMR. It's pooled data. It comes from different sources. On this slide, I've just picked up four. Of course, we all know there are many more which I may not have put here. Since Vivli is going to be talking about their ways, I have just kind of showed Vivli right on the top out here. And then we're talking also about the glass. Then you must have heard about resistance map, which is from an NGO, an academic institution, CDEP. And then we also have various genomic AMR databases. So all of these are, some examples and really helping in building sharing of AMR data. They all are different in different ways because their primary goals are different, but they have this information on AMR through various kinds of like the data type is different. For example, in Vivli, as you can see, it's individual or patient level, whereas Glass has surveillance aggregate. So, like this, the kind of data is different, but yes, it is there, and it can help further in deciding on how to use this data best. for mitigations of AMR and better diagnostics. So, yeah, so I'm sorry, but it was a short presentation. Basically, all that we needed to actually share with you was about the Global Health Network, which is the community of researchers, research organizations, and the goal is to bring everybody together, share knowledge, and when you go on the website of the TGHN, you can have a look and you can see it's just not AMR. We talk about various themes, and a lot of information is available for helping you uh, decide how do you want to do your research. In case you feel that you need some more information, that the knowledge is there, we connect you with lots of other researchers. And the whole idea is that we need to strengthen equity, which we know currently is not there. We also have specifically on AMR, since the main area we are talking about today is AMR. We also have a AMR Knowledge Hub, which has lots of resources for you to see and refresh, or maybe you can also share your information and any study examples you want to share. You can also put that up and connect with us. And recently, we have also been invited to establish a formal program with the UN Ops. And of course, I did mention about the importance of data sharing and why do we need collaborative data ecosystem. So that was about us and what we do. And thank you so much. I'm sorry for the glitches in the beginning, but happy to take up any questions. Thank you.
Thank you, Gitanjali. If anybody has any questions, please feel free to put them into the Q&A, and then we'll address them after the presentations, and then potentially within the Q&A if that seems more appropriate. And so I'm Dr. Amanda Skarlupka. I am a senior program manager here at Vivli. I have experience in, I have a PhD in infectious diseases for influenza vaccine development, and some previous experience as well in food safety microbiology. And then I also previously was a program officer at the National Cancer Institute for the National Institutes of Health at the US government. And so here at Vivli, though, I am the senior program manager for the AMR register. And I'm just dropping into the chat some resources for the register that I'm going to be covering today. And you all should be able to see my slides now. And so I'll be introducing all of you to the Antimicrobial Resistance Register, also known as the AMR Register. Today I'll be covering about 4 things: an introduction to the register, an overview of industry surveillance data, the use cases of some examples of how it's been used to date, as well as our AMR Surveillance Data Challenge. The AMR surveillance data is the Vivli AMR register is an innovative, fully searchable platform for high quality industry surveillance data. And so these surveillance programs are usually global in scope, and they monitor changes in resistance patterns to trends at a global, regional, and local level, and provide healthcare practitioners with susceptibility data to support the appropriate use of antimicrobials. However, prior to 2022, the AMR community recognized that there was a vital gap in the accessibility to this industry surveillance data. And so therefore, in 2022, the Vivli AMR register was initiated and has since shared these high quality industry surveillance data sets through an innovative, fully searchable platform. Our researchers that have requested the data have been able to successfully use it to detect trends in multi-drug resistance over time, to inform their national and international policy in antibiotic stewardship, and to also help model future resistance trends. The data sets that are available on the register are contain over 1.13 million different isolates. There's 15 data sets, with the information being collected between 2004 and 2023. We have data from 89 different countries, 19 of which are LMICs and 7 in sub-Saharan Africa. And we have testing information on 82 different antimicrobials and 609 different organisms. The AMR register is a membership base, and we have 10 different industry members who contribute their data sets for sharing. So these members have been generating local antibiotic susceptibility data, and have committed to sharing their data with researchers, the public health bodies, and healthcare professionals. And we work with them to help improve the understanding of the resistance trends and inform appropriate antibiotic and vaccine use over time. And ideally, this is to help increase surveillance capabilities globally. The AMR register itself is available at searchamr.vivli.org. And just an example of what a researcher or somebody who would like to reuse this data would do is they would go to that web link and they would see the search feature. They would be able to identify through our data catalog which data sets they were interested in. So for example, this individual here would select dataset alpha and dataset omega. They would put in a data request to that briefly explains kind of the research that they intend to do with the data, just to ensure that it's a valid and kind of a real researcher that's requesting the data. And then after approval, the researcher then accesses the susceptibility surveillance data. They do their analyses, and then they publish the results. Moving into an overview of industry surveillance data. The AMR register helps facilitate access to 15 different industry AMR surveillance data sets. One of the key things to note is that the register doesn't currently contain a wide breadth of susceptibility and surveillance data sets. It's really those industry focused private AMR surveillance data sets. So these are most commonly post-approval studies that are for susceptibility and resistance to an approved antibiotic that's been on the market. And usually that they're carried out for 3 to 5 years post market approval. So these are more regulatory in context rather than maybe some open or public surveillance data sets that are being collected more driven by governments or by academic research institutions. And so that's a little bit of the distinction between some of the surveillance data sets that are on the AMR register than what may be found more through other avenues. The other distinction is that we do have a requirement that the data that is available on the register is to be generated using the UCAST or CSLI reference methods for broth microdilution. And then most of the data sets that are available for access are very accessible in terms of data analysis, as they're provided in an Excel format that's available for download to the researcher. And the common data that's included in these data sets include the MIC data by organism and antimicrobial, the specimen source, where it was collected, whether it was a community or a hospital ward, for example, the country of collection, year of collection, the bug's phenotype, the patient's age or age group, as well as the patient's gender. To give a little bit more context as well for the AMR surveillance programs that are specifically from the industry, they're really to be complementary to the public surveillance programs. And we do also see a wide coverage of geographic areas for the data sets. And as mentioned previously in the overview slides, we do have a high number of antimicrobials because the antimicrobial that's tested is needs to be compared to existing ones that are on the market or previous ones that are um, now susceptible, and to also help decipher the phenotypes associated with specific resistance mechanisms. Um, People are able to use these data to do potential searches or research for infection sites, microorganisms, and antimicrobial indications, evolution of microbial resistance, geographic areas, as well as different breakpoint criteria. And not only is the MIC testing provided, but also the molecular testing to help enlarge information of the resistance genes as well as clonality. And so the data from these industry or private AMR surveillance data sets, there's some that are available through the AMR register. Once we have members, the members provide, as well as when they provide a publication, and some companies also have their own web platforms. And so I've introduced you to the AMR register, the data sets that we have there, and a little bit more detailed on industry surveillance data. We're entering about the fourth year of the platform, and so I wanted to provide a little bit of context of how that data is being used. And so the data requesters that we have who are requesting to reuse this data are actually coming from, it's a global community. We see great participation and reuse enthusiasm from across the Americas, Africa, Asia, Australia, as well as Europe. Um, when individuals fill out a data request, they indicate what their intended research is to be. They provide a short summary, about 300 words, of how they intend to use the data. And so we've conducted an analysis of kind of what researchers have indicated what they are planning to use the data for. And so we've identified that researchers are really interested in using the surveillance data for drug resistance trends and profiling, as well as creating tools and models for predicting resistance trends. There are quite a few other categories, as well as informing public health policies, strengthening stewardship, informing prescribing practices, and identifying mechanisms of resistance. And of note, we've received about 252 approved data requests. So the vast majority, 109 of them, are really focusing on the trends in profiling, though. I've included two examples of how the data has been, not only how they intended to use the data, but also the outcome of what the outcome of them using the data. And so I have this first one here is the title of their analysis is The Causal Inference of Antimicrobial Resistance Trends, Evaluating the Impact of Climate and Pollution Using Global AMR Data. It was a team of 4 individuals, and they were recipients of the 2025 Grand Prize for our AMR Data Challenge, which I'll cover shortly. And what they ended up doing was using Pfizer's Sentry data, their antifungal surveillance data set, and they examined the impact of air pollution on resistance to fluconazole in C. glabrata. And so they had a time series analysis that revealed that the time lag effects play a significant role in predicting trends in resistance. We have more information regarding their research project at the link below, and I'll also put it into the chat a little bit later. Another example of how this data has been used and analyzed and the research that has come out of it was another one of our data challenge participants. and they created a counterfactual machine learning approach in evaluating AMR policy impact. So this was a team of 2 individuals. They were also the recipients of the other grand prize for last year's data challenge. And they used data sets that were contributed by Merck, Pfizer, Shionogi, and Venus Remedies, as well as additional public data sets. And they built a model to help predict how different policies and antibiotic use practices might affect the rise of antimicrobial resistance. And so I touched briefly a little bit about the AMR Surveillance Data Challenge. And so I wanted to provide a little bit more context on that as well, because it'll help with our discussion a little bit later. So the annual Vivli AMR Surveillance Data Challenge has 3 aims. The first is to engage researchers and the scientific community globally to access and utilize the Vivli AMR register and participate in the longer-term sustainability of the platform. The second is to generate new insights or applications in AMR through access and reuse of AMR surveillance data. And the third is to promote the AMR register to encourage more industry partners to share their surveillance data through the platform when they can see that the data is having a real impact. And so inside the Vivli AMR Data Challenge, it's really focused around the participants. All participants are encouraged to participate in teams of 2 to 5 to foster that collaboration and team science. Um, we support data sharing by posting their solutions that they've created throughout the data challenge to open source forums such as GitHub for their code, as well as posting their reports and outcomes to our website. And then lastly, we want them to be innovative and creative when conducting their analyses. We provide prizes and incentives to help kind of foster the data reuse. And so we have grand prizes, impact and innovation awards, student awards specifically, and those include monetary and or travel awards depending on the different type. And then all finalists and awardees are invited to publish their research in the Welcome Open Research Collection, which doesn't have any publication fees, which helps address some of the fact that we have such a global data reuse community that it helps with the equity of those publication fees. And then the third one is we do have a judging panel that helps decide for the prizes of the data challenge and the awardees, and they're made up of members from the AMR Scientific Advisory Board, Vivli's AMR Steering Committee, the data challenge funders, as well as experts from the AMR research domain. The data challenge itself is an annual data challenge and is structured in such a way that in about between April to June, teams submit their expressions of interest. So that's that initial data request with about a 300-word expression of interest of what they plan to use the data for and which data sets they would like access to. The teams then have about 60 days to conduct their analyses, and then they submit their final report, which the judges then go through, and then they select the finalists. A subset of the teams are invited to be a finalist and provide a Zoom presentation to the judges. And then from there, the awardees are selected, and then Vivli will announce the awardees and finalists. Over the years, we've had 3 AMR data challenges. Our 4th one is starting later this year. And we can see that the impact of the data challenges have continued to increase. And we consistently have about 6 to 7 different awards over the years. And we've seen that the publications that are coming out of the data challenge are also very strong and with a little bit of a lag time as to be expected because they're research publications. And so we do have to kind of track that after the completion. But we've seen 14 publications come come out of our 2023 data challenge, 6 so far out of our 2024 data challenge, and our 2025 data challenge finished up last October. We haven't seen the publications haven't been finalized for that yet, but we do have, I believe, all of our awardees are traveling to ESCMID Global this year in Munich, Germany. So a lot of great outcomes and impacts coming from our data challenge participants. One of the key things about the Vivli AMR Surveillance Data Challenge is that to date, it has been an open data challenge. And an open data challenge or a creative data challenge is really to allow researchers to explore the data set in any way that they would like. And it helps encourage novel discoveries and creative problem solving. And it's best for uncovering unexpected insights and drive innovation. Initially, we had the data challenge as an open data challenge, and we still do, because we were just starting the data challenge initially, and we wanted to get an idea of how the data could be used, what were researchers' main questions regarding AMR surveillance data, what could be done. Since we're entering our fourth year and future years of the data challenge, we have been kind of wondering if we should provide a focused or targeted data challenge or maybe a subset. So potentially providing our data challenge participants with a specific task or goal that they should aim to achieve to be awarded a prize for the data challenge. And so for focused data challenges, this usually requires precise methodologies and structured problem solving. And it is best when specific questions are needed to be answered. And these should be crowdsourced from the experts within the community to make sure that the question or the research goal that has been established for the data challenge is actually relevant, high priority, and high impact for the research community and isn't addressing an unnecessary issue.